you say physical activity for cancer prevention or risk reduction, how do you define physical activity? Is that aerobic activity? Is that weightlifting?
It's such an important question, actually. So, physical activity is defined as any bodily movement that requires energy. So, exercise is a subcomponent of physical activity that involves planned, structured activity that people undertake to improve their health or fitness. So, for example, going to the gym and going for a run. Now, the evidence is mostly on total physical activity and exercise. So the evidence suggests that any physical activity is beneficial in any sort of domain, whether that's exercise or that's things like walking up the stairs. But the majority of evidence is around moderate to vigorous aerobic exercise. So at the moment, the best available evidence suggests that higher amounts of moderate to vigorous aerobic exercise is the best mode of exercise for cancer risk reduction. Now, there is much less evidence on weight training, and that's absolutely not to say that that's not beneficial. When you look at global physical activity guidelines for public health by WHO, for example, they very much recommend that you engage in at least 2 to 3 resistance exercise sessions per week. In the cancer prevention field, there's just much less evidence. And that's mostly because the questionnaires that have typically been used to capture physical activity and link to cancer outcomes actually focus on aerobic exercise. So they ask less questions around weight training, which is something certainly that needs to change.